Hi, I'm Sharrie Darlin-Davis, program host for Reid Beside You. And thanks for joining us today. And today, our guests are Tracey Dingwerth, a diabetes educator, and Dr. Erica Kretchman. Welcome, ladies.
Thank you for having us.
And first off, we know that November is Diabetes Awareness Month. So that's why we're so excited to have you both on. And the overall theme for 2020 is Nurses Make the Difference. And we want to celebrate you, Tracey, as well as Dr. Kretchman. Can you give us an example of how much the nurses help in your practice?
Thank you so much for bringing up this theme, because I think when it comes to people who live with diabetes, it is often those nurses that are in the front line with them that can make a difference in teaching them how to navigate their road, their map. I can speak personally from my experience of being a young child diagnosed with diabetes. If I didn't have that nurse sitting with me, encouraging me to take my first injection, I probably would have left the hospital with a different outlook. The things that nurses do to really understand each person in front of them and help them navigate how their diabetes is needing to be managed is incredible. And I am so lucky to work with fantastic nurses like Tracey. We have a few more in our office. We have Melody, we have Denise, we have Dina, we have Natalie King, who is a nurse practitioner, and just the immense greatness of nurses that are in the Reid system and throughout the world. I thank them all, because I don't think we could do the job that we're able to do without the nurses at our side.
Well, we are so delighted to have all of those great nurses on our staff.
Absolutely.
And another thing, just overall, just tell us, what is diabetes?
Great. That's a really great question. So diabetes is a chronic disease in which the body doesn't handle glucose and insulin in the way that it should. There are a bunch of different types of diabetes. So sometimes people are confused on whether it's type 1, type 2 diabetes, or gestational diabetes. But what we generally find is that there is a lack of insulin or insulin resistance at the cells, which means the body can't use the glucose that it's making or that we're eating from our food to be turned into energy. And as blood sugars get high, this is where we get those symptoms from diabetes, like increased thirst, increased urination. Sometimes we see that people may have blurred vision, and often where we see that they get diagnosed with diabetes. It can be managed depending on the type with lifestyle, which is a very important aspect of diabetes management, no matter where you are, whether you need medicines or not. Oral therapies, non-insulin injection therapies, and then of course insulin therapies. And we have a bunch of technology now that helps us manage diabetes through ways to deliver insulin and ways to monitor blood sugars.
Oh, great. And I just wanted to give an overall description of what diabetes is. But the biggest part of our discussion today will be on how COVID-19 impacts people with diabetes. So are people with diabetes more likely to get COVID-19?
So no, there really isn't any evidence to say that any individual with diabetes has a higher risk of being infected with COVID-19. I'm going to encourage everybody out there that's listening, because typically these may be individuals who have diabetes or love someone who has diabetes, is a very important thing for all of us to do is to be appropriate with our hand washing, making sure that we are social distancing or staying 6 feet apart when we have to be in spaces where together, wearing our mask and having proper mask hygiene, and also making sure that you limit the amount of social interaction or being out in public, and especially being home if you are sick. But someone with diabetes doesn't have a higher risk of getting COVID as somebody without diabetes. But the one thing why this is such a good question is that we kind of recognize that people with diabetes can have more serious infections if they do get infected with COVID as compared to those without.
Okay. Another thing is, how is your office doing things differently to help prevent the spread of COVID-19?
We have done, which is a very it's kind of varied as we've learned more about the disease state. Initially we recognized that people who had diabetes had higher risk of serious illness with COVID. One thing that I do want to say in regards to this is that diabetes control really does help reduce that risk. We've talked to the people living with diabetes every time they're here about managing and controlling it to reduce risk of complications. Severity of illness from COVID is one of those things that they can manage or not have a severe risk if they have better control of their diabetes. So we knew right off the bat that we couldn't just stop seeing people, that we needed to make sure we had a way to get care, get people the medicines that they needed. So we moved really to these type of things, these virtual visits, where instead of seeing me physically, we were able to talk to you through your computer or your cell phone. We realized that some people need that interaction or need to come here anyway for device downloads. So we still kept kind of the in-office visits, but we tried to keep those for people who are at lower risk. And now we kind of do a combination of everything. I think what is great is for these urgent need appointments, it's much easier to fit in a virtual visit with somebody. And then we have all these precautions set in place in our waiting room. The chairs are spaced, so you won't be 6 feet with encountering more than 6 feet with any other individual. We ask that individuals come alone unless a caregiver is needed. Everybody has hygiene to clean after someone sat in a seat. And of course, we're always washing our hands, and everybody is wearing a mask all day long here to make sure that we reduce the risk of spreading any potential risk of illness to somebody else.
I was amazed when I came into the various offices, and as soon as someone got up, they put a sticker or a piece of paper that says, "Wait until this is clean,"
Yep.
So that the person following them didn't sit there until they cleaned the where they were seated. So I was
Yep.
really impressed.
And that is absolutely what we're doing, in the same sense that when somebody gets up from the waiting room, either it's cleaned right away or a sign is placed there to let someone know that it needs to be cleaned.
Great.
And then our rooms are getting that extra wipe down in between each visit for the in-person.
Erin, we have to give hats off to all of our staff, and especially the environmental services team. That have been amazing.
I see Tracy's back too. And I think, I'd love her to talk about the experience with the diabetes nutritional education and COVID, because they had more group visits or things that went together, how they kind of manage it, made sure they could get the people in with diabetes and good education. So I don't know if you wanted to answer that question too, Tracy.
Sure. I echo everything that Dr. Kretchman said, but having that awareness that although people aren't going to be more at risk to get COVID because of their diabetes, their course with COVID could be worse if their diabetes is not well managed and well controlled. So therefore, we still need to continue to be educating people how to live well with diabetes. And so a lot of what we do is classroom settings. And although we did put them on hold a little bit at the very beginning, we kind of had to rethink what we were doing and find ways that we could still provide that education and still be very confident that we were keeping people safe. And so we have cut our classroom sizes in half almost, as far as the number of people that we're having together. We have added some additional classroom options so that we can then bring some of those other patients in where we had to make our classes smaller. So that has enabled us to continue to get people in a fairly timely manner. And again, with all of the hygiene and the cleaning, and we are keeping people very distant, even in the classroom setting, and we're all still wearing masks. So we're very confident that we're able to safely provide that education. And then I have done the best of my ability to try and continue to get people trained as far as technology, people who have a new insulin pump, things like that. We really wanted to find a very safe way to be able to help them to move forward in good diabetes management. And we have been able to do that successfully, which is wonderful.
And that's been a learning curve for all of us, as well as when working in the community and making sure people had the correct technology as well as just using that technology.
Yes.
I like to share that when we did our first Zoom for our Medical Monday, the person that did the best was 91. So
Wow.
she had become very accustomed to doing that with her family members. So everybody can learn. One of the other things on your with having, because we always hear underlying conditions and complications, how does that worsen the chance of getting seriously ill from COVID-19, like other viral infections?
You know, when the body is exposed to something foreign like a virus, and especially in this case with COVID-19, the body will fight it. And it fights it with things that often can affect our glucose control. So it gives these different amounts of immunogenic substances, steroids that will raise our blood sugars. And, you know, it's important that at any time that you pay close attention to your blood sugars, and especially if you start to have symptoms of feeling ill. And this is for any illness, including COVID-19. So if you are having fevers or shortness of breath or cough, anybody with diabetes should take care to increase their monitoring of their blood sugars, make sure that they are doing well to stay hydrated, that they are on top of taking their medications. And if they find that they aren't able to get their blood sugars under good control, sometimes this may lead to more serious complications from diabetes. They should reach out and talk to their healthcare provider. And, you know, there we guide them to do things like test their urine for ketones, or maybe increase their medical therapy so they are able to help get their blood sugars under better control. Because, you know, even though the illness is going to cause their blood sugars to rise, we know that oftentimes when blood sugars are high, it's harder for the body to fight infection. So this is why, just like they do day in and day out, when you add illness to your typical diabetes routine, you just need to add a new intensity for control.
And does COVID-19 cause diabetes?
So there isn't any evidence that COVID-19 is going to be something that will cause diabetes. We do see some people who are not diagnosed with a medical condition like diabetes who may experience some high blood sugars during an infection like COVID. And that's a part of just that body's fighting it out, but it doesn't mean that they will leave the hospital with the diagnosis of diabetes.
Then, so do I need to worry about diabetic ketoacidosis?
I was just going to echo what Dr. Kretchman mentioned earlier about when people with diabetes are ill, blood sugars are more difficult to control anyway already. And so COVID-19 is not going to be a whole lot different in that regard. And so when blood sugars are high, and oftentimes it's easier for people to get dehydrated, the immune system is being impacted to some degree, then DKA that you mentioned, Sharrie, or diabetic ketoacidosis, is something that is a concern, as it always is. And during our classes, one of the really important things that we feel very strongly that anyone living with diabetes should be well versed at is how to manage their health and their diabetes when they are ill. And so we teach very similar principles that Dr. Kretchman talked about, and it involves staying hydrated, making sure you're getting at least 8 ounces of calorie and caffeine-free liquids every hour that they are awake. And that's waking hours, not, you know, I was awake, I felt terrible, I slept for 10 hours, now you're all that fluid behind. So really keeping up on that fluid intake. We still need to try to bring some carbohydrate in. They still need to be taking their insulin, although if they have any questions, they need to check with a healthcare provider maybe for dosing, but they can't just quit taking insulin because they're not eating. Those are a lot of things that we encourage people to do. And one of the big things that I see is people really need to be testing their blood sugar much more frequently when they are ill than when they are not ill. And sometimes people are thinking the opposite because they haven't eaten all day. So they're not necessarily thinking about or checking their blood sugar. And so, you know, you need to check it way more often when you're not eating anything and you're not well. And then when you see those blood sugars begin to rise, we can get ketone sticks. Those are over the counter. You can kind of pass that stick through your urine. It'll change color. You can see if you're passing ketones. If you are and blood sugars are climbing, that is always a sign that you need to contact your healthcare provider and then see what those next steps might look like.
Okay. And is COVID-19 different from the seasonal flu?
Yes, these are two different infections, or from two different. This is a kind of different form of the coronavirus, and it can provide a more serious illness than that seasonal flu, especially in people with diabetes. You know, we still are going to follow that same standard precautions to avoid infections. But, you know, we have seen some more serious complications or different complications for those who are infected with COVID-19 that we don't see as commonly with the flu, including some cardiac complications. We don't often see those things with like altered taste that we are experiencing with COVID-19 as compared to the seasonal flu. And of course, now this is a big time that we're kind of feeling a little bit more risk because this is flu season, in addition to the fact that we are still seeing cases of COVID-19 and seeing some increase in the cases of COVID-19 in our community. So I would really encourage, as we would encourage every year, that people with diabetes and really the population in general, if you are a candidate, go to get the vaccination against influenza to help kind of minimize your risk of two really severe illnesses in this time frame. So seasonal flu is still something that is really hard for people with diabetes. So I love the tips that Tracey has provided to be more adherent to watching your sugar closely, staying hydrated, and trying to make sure that you still have some nutritional intake, because we don't really want to see either illnesses in our people with diabetes.
So what are the symptoms and warning signs I should be watching for? And what do I do if I think I'm developing them?
So with what
we're overcautious right now.
Yeah, I mean, this is a really kind of big question, because, you know, we've seen just a variety of symptoms with COVID-19. You know, some people are asymptomatic, and in general, that's okay. If you're asymptomatic, then you're probably not going to have too bad of an impact on your glucose control or too many problems. But, you know, generally what we're seeing is that people are maybe presenting with cough, fever, shortness of breath. We've seen that change in taste or change in smell. Some people will have those total body aches or muscle aches. We've even seen some diarrheal symptoms that come with it. So those are kind of some of the symptoms that you may watch out for to be suspicious of having COVID-19. And a lot of those crossover influenza too. Of course, another thing that you really want to always be aware of is kind of the risk or exposure. I think one thing that our community has been very good about is not hiding the numbers, or not hiding if the cases are going up or the infections. You know, I'd say I'm very proud of our community to kind of keep reporting things to each other. If there are cases in schools, if there are cases in facilities, I think that we are doing a good job of trying to protect each other.
And are there things you should have if you need to call your doctor?
What I would suggest, you know, with this situation, if you're experiencing these symptoms and it's becoming hard for you to handle, the fever is not responsive to treatment with Tylenol or ibuprofen, you're having severe shortness of breath that you can't do your typical activities of daily living, that's when you need to seek medical care. And I would say maybe even going into our respiratory clinic or going into the emergency room are options. Of course, you can reach out, and the fact that we have a lot of these virtual visits makes good care for people that have respiratory illness but don't want to put others at risk. We as a medical community have developed a lot of different ways that we can kind of test what your possible shortness of breath or what your possible oxygen saturations could be through just kind of virtually talking to each other. So if you're someone like me who can just talk and not have to take a deep breath, that's a good sign that your body is able to maintain some oxygenation, and you may be able to be watched at home. Or sometimes they may find something that looks like a warning sign. If you can only say a few things, they may want you to go into the respiratory clinic to get blood work or an x-ray or get that COVID testing.
And I just want to reiterate just the importance of doing that immediately.
Absolutely. Yeah. So even in these early signs, if you have concerns, I would reach out to your physician's office or the respiratory clinic to see if something like a virtual visit is available for you. And then there are a lot of great facilities in our community for COVID testing. If it's something I know, a lot of people that experience, it's not just our people with diabetes, but some who will have family members that have diabetes, or maybe their family members that are older and at risk, when they have, we see a lot of sinus infections right now. We're seeing, strep throat because we're back in the community. Sometimes the test just needs to happen to make sure that we're not putting the other loved ones we have at risk. So sometimes just talking to your providers, your clinicians about what should I do, what to look for, or should I get tested? Where do I get tested?
And are the risks different for people with type 1 and type 2 diabetes?
Yeah, there are different risks. I mean, one, the blood sugars are going to go and be harder to control in both type 1 and type 2 diabetes. But the risk of that condition that you asked us earlier called diabetic ketoacidosis is much higher in individuals with type 1 diabetes as compared to type 2 diabetes, because in this condition, they don't make insulin at all. And like Tracy kind of mentioned earlier, one of the mistakes that people with diabetes make is they feel, I'm so sick, they sleep all day, and they miss or don't take their insulin. And unfortunately, this is the worst thing that you can do if you're an individual who is type 1, or even in that type 2 population that takes insulin, because as soon as that happens, if you miss taking your insulin, your body starts to make ketones and it gets sicker and sicker. And we end up seeing people in the hospital with either severe high blood sugars or diabetic ketoacidosis. So the risk is really big for both diseases. But again, for both conditions, for type 1 and for type 2 diabetes, the better control you have before you get a serious infection, the less risk you're going to have of serious complications.
And I was just going to reiterate that whole high blood sugar thing. The better controlled, whether type 1 or type 2, the better under control they are, the better their body is going to fight any type of an illness or respiratory illness, including COVID. And the higher those blood sugars are, I think really people with type 2 can't feel like they're just safe and they're not going to have any problems. If their blood sugars are not well controlled prior to contracting COVID, they could very easily have more difficulty fighting that off. And so I think at the end of the day, really just making sure that you start now getting really good control of those blood sugars to the best of your ability is really the best thing that people can do to plan ahead, to just have to prepare their body to be able to fight any illness that's going to come along, including COVID-19, to the very best of their ability.
And also, we're seeing with COVID and slowdowns with mail and other things, what's the impact for your access to insulin and other diabetes supplies?
Right now, I think that not just us as a medical community, but the companies that make insulin or the companies that provide medical supplies for people with diabetes have really been open to kind of say, hey, we're not having any production issues. We don't see any risk of being short in supply for insulin therapies or for medical supplies. And in fact, there's been a lot of companies, if you're somebody out there that has struggled with the cost of insulin, because that's a whole nother discussion that we can have with this COVID crisis, they have really created programs for those who may have lost insurance because of job loss or may not have the financial ability to get insurance, that they will have a reduced price or option for it. And there's a lot of different facilities that in our community that have access to these programs, or your providers have access to the programs. Or even a simple Google search, what are programs to help me afford my insulin? They can run into something from most of these major insulin companies. So there really hasn't been a risk of shortage for medical therapies. Of course, I just worry about the risk of people with the finances and the ability to get control. So don't ever go without. Talk to your provider, talk with the healthcare providers in your community, talk to your pharmacist. There's a lot of people who know these programs out there that are made for people who are struggling to get the life-saving medications that they need.
And just real quickly, just wanted to, as we wrap up, wonder if someone in my household has the virus. What should we do?
So
And how they can protect themselves.
Yeah, that's a really good question, because we definitely know that the risk of spreading the virus is biggest when we're in that same dwelling, which is why we've seen outbreaks or cases in nursing homes, in jails, and shelters, and dorm rooms. So if you are an individual who is known to have COVID in your house, you have to be extra precautious to stay isolated, to stay in an area where you can be by yourself. I would suggest that you wear a mask when you have to go into common areas, and even wear the mask if you're able, if it's something that you can feel comfortable with in your own common room, and wash frequently. Make sure that you are frequently washing your hands, and everybody else is doing the same. We still care for each other. We can still provide that water and that food and things that we need. But after any contact, you make sure that you wash your hands to kind of avoid that risk, and then try to make sure the people in the house try not to touch their face or other areas in which they may have an increased exposure to the virus. And I would really suggest too, when someone who you love or you live with is ill and COVID positive, that you get tested too, and everybody should self-isolate. So if you have one person in the family, there's a high risk that the other people get it. So nobody else should be going to work or going to school. Everyone should stay there together to decrease the risk of spreading the illness to other members of the community.
Well, thank you. This has been a very informative episode. And we want to thank you, Tracey Dingwerth, and Dr. Erica Kretchman for joining us on this episode of Reid Beside You.